There are growing concerns over yet another deadly virus outbreak. Doctors are monitoring an Ebola epidemic in Africa that may be to blame for dozens of deaths so far. CBS's Lilia Luciano has the alarming developments and speaks to a U.S. ER doctor who survived the virus.
In Congo's Ituri province, health officials are battling a new Ebola outbreak. The Africa CDC says there are 246 suspected cases and at least 65 people dead, the highest death toll from the disease in years. The World Health Organization is concerned.
Well, we know very well that the country has experience, but the region where it is happening is highly volatile, with the humanitarian situation going on and the population moving around from South Sudan to Uganda and other parts.
Government officials confirmed the outbreak has now spread to Uganda.
Medical professionals seem very concerned about the possibility or the ability to contain this. Why is that compared to other times?
It's already a big outbreak at the point that we're hearing about it. There have already been a number of deaths, and this is a strain of Ebola for which we have no treatment, no vaccines.
The virus spreads through direct contact with blood and other bodily fluids. Dr. Craig Spencer contracted Ebola while working in Guinea in 2014.
Healthcare workers are the group that I'm really concerned about because they have very close contact with people when they're most contagious, particularly around the time of folks' death.
And the U.S. has been the single largest external player in Ebola response in the past. Now experts are worried that the dismantling of USAID and the U.S. withdrawing from the World Health Organization could have an impact in the global efforts to contain the virus. Major?
Lilia Luciano, thank you.
At least 80 deaths are being attributed to the Ebola outbreak in Congo's eastern Ituri province. There are 246 suspected cases so far, and health workers are racing against the clock to intensify screening and contact tracing to contain the spread of the virus. Officials believe the index case is a nurse who died at a hospital in Bunia, which dates back 3 weeks to April 24th. For more on this, let's cross now to London and bring in Dr. Gemma Najati Jalani, the research associate at the School of Public Health, Imperial College London. Gemma, thanks so much for joining us. So today, let's start with the virus. It's got a fairly high mortality rate. How does it spread and what are the symptoms?
So yes, you're right. The mortality rate is quite high for Ebola. Across all of the strains, on average, about 50% of people who get the disease are likely to die. We do have some information now about the strain that's spreading. It's the Burundi-Buja strain, which has, based on previous data that we've been able to collect in previous outbreaks, it has a slightly lower severity, I think, in the previous outbreaks. Between 30 and 40% of people who contracted the illness died. So it is still a very, very serious disease. So the symptoms of Ebola are quite varied. They can come on quite suddenly. Early symptoms might include things like fever, fatigue, muscle pain and headaches. But further later symptoms might include vomiting, diarrhea, rashes, and in both internal and external bleeding. It mainly spreads through infected bodily fluids, so through blood, through urine, through contact with people who are highly infectious, but also through contaminated surfaces, which might be, say, for example, bed sheets or bedding.
Now, Doctor, as you just mentioned there about these different strains, there is actually a vaccine for one of them. How effective is that vaccine? And are there plans now maybe to look at developing vaccines for these other strains?
Yeah, so as you mentioned, there is a vaccine against the Zaire strain, which is the most common strain that occurs, and that is highly efficacious. At the moment, there is no vaccine against the Burundi-Buja strain, but I think that WHO, African CDC, will be in contact with many of the major vaccine manufacturers to try and speed up development of vaccines for this strain specifically.
Now, this region is no stranger to outbreaks. In 2014 and 2015, Guinea, Sierra Leone, and Liberia were hit by an Ebola epidemic that eventually ended up killing more than 11,000 people, sickened more than 28,000, spread across 10 countries. So are we looking with this current outbreak, are we looking at something that could get that bad?
We don't know at the moment. It's still very much in the early stages. It is a notable outbreak in the fact that, as you mentioned earlier, there have already been 246 suspected cases. There's only 13 confirmed by lab results, but it does seem like it's quite a large outbreak with, as mentioned earlier, 80 suspected community deaths. So it could be much larger than many of the outbreaks we've seen before. You referred to the 2014 outbreak in West Africa, which was an incredibly large outbreak, the largest outbreak of Ebola we've ever recorded or seen. This is what is happening in the DRC, and the DRC is very experienced with dealing with Ebola outbreaks over the last 50 years, and this is the 17th outbreak to occur in DRC. So they do have a very strong public health response. They do know exactly what they need to do to control the virus. So hopefully we will not be faced with an outbreak on that scale.
Now, where this current outbreak has happened, it's a fairly remote area, but one that's been dealing with a lot of political instability. There are militant groups operating there. Does that complicate efforts to contain it?
It definitely makes things more challenging. So there was an outbreak of the Zaire strain in this same region in North Kivu and Ituri in 2018 to 2020, which had over 3,000 cases. And I think, obviously, political problems and conflict going on can make it much harder to respond, to get the people you need to the places they need to be and to get equipment into the areas. But I'm very, very hopeful that the DRC, with the support of WHO and African CDC, can get the response to the area it's needed very, very quickly, and to make sure that all the supplies and personnel they need are there in place.
Now, we know contact tracing is going on to try to find out who has been in contact with people exposed, but how else does one contain an Ebola outbreak?
So one of the key features of containing an Ebola outbreak is trying to isolate identified cases to try and break trends of transmission. So as well as finding contacts of known cases, identifying and confirming cases is going to be very important. Using isolation facilities and supportive treatment to try and care for them, in specific Ebola treatment centres, will be very, very important. Infection control measures as well, increased use of PPE in hospital settings to protect healthcare workers will be very vital as well. And also engaging the community as well, going out and talking to people in the neighbourhood to raise awareness, to make sure that people are aware of the ongoing outbreak and how best they can avoid contracting the illness. Another really, really important aspect for Ebola comes around burials. So one of the features of Ebola virus disease is that even after someone has passed away, their body can remain infectious for a short period of time. So it's very important to have safe and dignified burials that ensure that transmission doesn't occur at funeral settings, but that also respects the cultural traditions of the area.
Gemma, thank you so much for speaking with us and sharing your expertise on Ebola. That's Dr. Gemma Najati Jelani, Research Associate at the School of Public Health, Imperial College London. And now is